Yeah. So Swapna, Godugu. Here we are. Yeah. Right. Get going. Once you are ready, you can start, Swapna. If you want to have ask me any questions before we commence our session, you can ask me later.
Sir, I cannot you hear that much, sir.
Yeah. Can you hear me now?
Yeah, sir, I can hear you.
Yeah. If you have any questions, you can ask me straight away.
No, sir. Can I
Okay.
start the session, sir?
Definitely. Why not?
Good morning. Please be seated.
Good morning, nurse.
I'm Swapna, one of the nurses working in this medical clinic. Please tell me how can I assist you today?
Nurse. I don't know what's wrong with this doctor. He asked me to meet you, and he's telling that you will teach me insulin injections procedure. I don't know why. Why? What's the reason behind that?
Yes, don't worry. You're in the right place. Definitely, you will get a better treatment. I will see your case notes. Before proceeding, could you tell me your name and age for the record purpose?
My name is Ben Johnson, and I am 60 years old.
Okay, Mr. Ben Johnson. So you're here for the self administration of injections for your diabetes. Am I correct?
Yes, of course, nurse.
Okay, so Mr. Benjan, so you are using diet and medication, oral medication for diabetes, but it is not effective for your condition. That's the reason doctor is advised these insulin injections, and moreover insulin and glucose level is little bit higher than normal. That's the reason doctor advised to take insulin injections, Mr. Benjan.
Okay,
Is it sound
nurse.
good?
That's okay. What to do? I have to listen to him now. But I have been managing my diabetes well with my diabetes diet, medication regimen, and exercise program. Still, is that needed now to change this
Yes.
practice?
Yes, I totally understand your concern, Mrs. Benjan. It's needed because you're doing excellent and you are taking care of your healthy condition more. But still, because what I said before, no, the glucose level is little bit higher. That's the reason. It is important to take insulin injection to overcome the problem, to control the diabetes.
Okay.
And do you know how to take insulin injections?
No, nurse, I do not know how to take it. But if you tell me, I will take it. But the thing is, I'm little bit scared of these injections. Uh, so I don't know whether I can manage it or not. But let me see what to do. Come on, explain me further.
Yes, I can understand your anxiety because this is a new for you because you are going to take injections and it is little bit painful and you have to deal with the needles. That's the reason I think you are feeling little bit anxious. But it is very easy if you follow clear instructions and if you practice well. I hope it is easy for you to take the injections if you follow the instructions.
Okay,
And
I'll follow them. Tell me, nurse, explain me more.
insulin injection is very important because it is a because faster absorption into bloodstream and it will not broke into the stomach because we are going to use thin fine needles for you and it will give a more effectiveness compared to oral medications. Is that
Oh,
sound good, Mrs. Benjon?
okay, nurse, definitely I can understand. And yeah, explain me what is the procedure, how I should go
And
ahead.
okay, your question is so sensible. Step by step, I will explain how to take an injection. Is that fine for you, Mr. Benjamin?
Yeah, please go ahead, nurse. Please explain me
Okay.
everything.
Firstly, you have to wash your hands and you have to dry and pinch the skin, and you have to place the needle, and the importantly the sides where you have to take is very important, and mostly upper arm and around the belly and thighs you can take this medication. And the you have to insert the needle 45 to 90-degree angle and leave in the place for a 5 to 10 seconds. And moreover you have to rotate the injection site so it will give a more absorption into your bloodstream, and importantly it prevent the formation of lumps in the skin and blood. Are you with
Okay.
me, Mr. Benjon?
Yes, of course, nurse. And
uh,
yeah, should I take the same needles every day and syringes, or should I change it with a new one?
Yes, your question is so sensible. I will explain regarding that. First, for the safe needle disposal, we are going to provide suitable containers, and proper handling care is very important. After injection, after injecting the insulin, you have to dispose that insulin syringe into that container, and it is very important. And for insulin vials you have to store in the refrigerator which you not open, and avoid sun exposure and high temperatures. It may not work that much if you expose to the sun. And importantly check the expiry dates also.
Okay, nurse. Definitely,
And
I'll do that one.
okay, and do you have any more questions and any more concerns to
Yeah,
clarify from me?
what happens if there is some problem like bruising or itching or pain or something like that? Then what am I supposed to do?
Yes, this is a good question, Mr. Benjamin. And please avoid to take a same place. If you take today, if you are going to take insulin on belly, and tomorrow you have to take on thigh, like that. If you change the place, the it may not hurt that much, and bruise will not be happen, and the absorption will be good and lumps will not form. So this is helpful for you to not to hurt. I think I
Okay.
have cleared everything, Ms. Benjan. And do you have any more questions?
Yeah, of course, nurse. Everything is clear.
Okay.
I got a clear picture. Thank you very much for your valuable explanation. And lastly, now I'm going to take the injections, and you just sit back and watch me taking myself an injection.
Okay. Thank you for your willingness, Mr. Benjan. Okay. I will observe how we are going to take injections. Thank you.
Right, nurse. Thank you once again. Yeah. So that was a good speaking session.